There's a quiet moment that happens in many people's lives when a routine medical test, something you trusted for years, suddenly leads you down a path you never expected. And what worries me most is how often people don't even realize the risk until it's already unfolding. Before we go any further, if you care about your health and want to stay ahead of problems most people miss, take a second to like this video and subscribe. I share this kind of information because I've seen what happens when people don't hear it in time. Now, I want you to imagine this. You go in for what seems like a standard checkup. Nothing feels seriously wrong. Maybe you're just a little more tired lately, or your energy isn't what it used to be. But overall, you feel fine. That's the word I hear all the time. I feel fine. And yet, behind the scenes, your body may be telling a very different story. What I'm about to tell you might surprise you. Not every medical test is automatically helpful, especially as you get older. In fact, some checkups that are commonly recommended can sometimes lead to unnecessary stress, invasive procedures, or treatments that may not actually improve your quality of life. I've seen this happen too many times. A patient walks in healthy, independent, enjoying their life, and leaves with a cascade of follow-up tests, medications, and anxiety that slowly chips away at their well-being. Now, let me be very clear. Medical testing is incredibly important. It saves lives every single day. But the key is understanding which tests are truly beneficial for you and which ones may not be as necessary as you've been led to believe, especially after a certain age. Most people don't realize that as your body changes, the balance between benefit and risk also changes. A test that made perfect sense at 45 may not carry the same value at 65 or 70, and yet, many people continue these routines without ever questioning them. That's where problems begin, because sometimes it's not the illness that causes harm first. It's the overtesting, the overdiagnosing, and the treatments that follow. And in the next few minutes, I'm going to walk you through 5 medical checkups that I personally approach with extreme caution after the age of 65. Not because they're bad, but because their risks, limitations, and unintended consequences are often misunderstood. Some of these may already be part of your routine, and that's exactly why this conversation matters more than ever. One of the most commonly discussed screenings I get asked about, especially by men over 65, is the PSA test for prostate health. On the surface, it sounds like a simple, responsible step, a quick blood test to check for early signs of prostate cancer. And in some cases, it absolutely has value. But here's where things become more complicated than most people realize. The PSA test doesn't actually diagnose cancer. It measures a protein level in your blood that may be elevated for many different reasons, not just cancer, but also benign prostate enlargement, inflammation, even recent physical activity. What I'm about to tell you might surprise you. A high PSA doesn't necessarily mean something dangerous is happening, and yet, once that number comes back elevated, it often triggers a chain reaction. I've seen this happen too many times. A man feels perfectly fine, goes in for routine screening, and suddenly he's being referred for a biopsy. That biopsy can be uncomfortable, carries a small risk of infection, and most importantly, it can detect cancers that may never have caused harm during his lifetime. This is what we call overdiagnosis. Most people don't realize that many prostate cancers grow so slowly that they never become life-threatening, especially in older adults. But once they're found, the psychological weight alone can be overwhelming. The word cancer changes everything, even when the actual risk is low. From there, some patients choose treatment, surgery, or radiation that can come with long-term side effects like urinary issues or sexual dysfunction. And in certain cases, those treatments may not significantly extend life expectancy, particularly if the cancer was unlikely to progress. Now, this doesn't mean the PSA test is useless. Not at all. For some individuals, especially those with higher risk factors, it can be an important tool. But after 65, the decision becomes much more personal, much more nuanced. What matters is not just whether you test, but whether the results will lead to decisions that truly benefit your life, not just medically, but emotionally and physically as well. I often tell my patients, the goal is not simply to find disease, the goal is to protect your quality of life. And sometimes, that means asking a deeper question before agreeing to a test. If this result comes back abnormal, what will I actually do next? Because the answer to that question can change everything. Another test that often continues well into later life, sometimes without a second thought, is the screening for colon cancer, commonly done through a colonoscopy. Now, I want to be careful here, because this is a test that has saved many lives when used at the right time. But after a certain age, especially beyond 65 or 70, the conversation begins to shift. Most people don't realize that colonoscopies are not completely risk-free. They involve sedation, preparation that can be physically draining, and in rare cases, complications like bleeding or perforation of the colon. For a younger, otherwise healthy individual, those risks are typically low and acceptable. But as the body ages, recovery becomes slower, and the margin for complications becomes narrower. What I'm about to tell you might surprise you. The benefit of continuing routine colonoscopies later in life depends heavily on your overall health, your previous screening history, and your life expectancy, not just your age. I've seen patients who diligently went for every recommended screening year after year, even when their previous tests were completely normal. They assumed, this is what I'm supposed to do. But no one stopped to ask whether continuing the test was actually providing meaningful benefit anymore. In many cases, if someone has had consistently normal results and no significant risk factors, the likelihood of finding a dangerous, fast-growing cancer later in life becomes quite low. At the same time, the potential downsides of the procedure begin to carry more weight. There's also something else that isn't talked about enough: the emotional toll. The preparation, the anxiety before the procedure, the waiting for results. It all adds up, and for some, that stress becomes a recurring burden that affects their overall sense of well-being. Now, this doesn't mean colon cancer screening should be ignored. Not at all. There are less invasive options available today, such as stool-based tests, which may help monitor risk in a gentler way for certain individuals. The key is personalization. I often tell my patients, screening is not about doing everything. It's about doing what makes sense for you now, because medicine is not one size fits all, and what protected you at 50 may not serve you in the same way at 70. So if this is a test you've been doing routinely, it might be time to pause, not out of fear, but out of awareness, and have a thoughtful conversation with your doctor about whether it's still the right choice for where you are in your life today. There's another screening that many women continue out of habit, often without realizing that its role can change over time, and that's the routine mammogram. Now, let me say this clearly. Mammograms have played an important role in detecting breast cancer early. For many women, especially between the ages of 40 and 60, they can be a valuable tool. But after 65, and especially as you move into your 70s and beyond, the conversation becomes more individualized than most people expect. Most people don't realize that not all detected cancers behave the same way. Some grow quickly and need attention. Others grow so slowly that they may never cause harm during a woman's lifetime. What I'm about to tell you might surprise you. Mammograms can sometimes detect these slow-growing cancers, leading to treatments that may not actually improve overall health or longevity. I've seen this happen too many times. A woman feels well, active, independent, living her life fully. Then a routine mammogram finds something small. Suddenly, she's facing biopsies, possible surgery, maybe even radiation. And while those treatments can be appropriate in certain cases, they also come with physical and emotional costs. fatigue, discomfort, anxiety, and the constant feeling that something is wrong, even when the actual risk may be low. There's also the issue of false positives. As breast tissue changes with age, mammograms can sometimes pick up abnormalities that turn out to be nothing serious. But getting to that conclusion often requires additional imaging, more appointments, and sometimes invasive procedures. Now, this doesn't mean mammograms should be automatically stopped after a certain age. That's not the message. The real issue is whether continuing routine screening aligns with your overall health, your personal risk factors, and your preferences. For example, if a woman is in good health and would choose to pursue treatment if something is found, continuing screening might make sense. But if someone has other health conditions or would prefer to avoid aggressive treatments, the value of detecting something early becomes less clear. This is where thoughtful decision-making becomes essential. I often encourage my patients to ask a simple but powerful question. If this test finds something, what would I realistically want to do about it? Because the answer to that question can guide whether the screening truly serves you or simply adds more complexity to your life. And sometimes, protecting your health means not just detecting disease, but avoiding unnecessary intervention when it may not truly benefit you. There's a test that often feels reassuring on the surface, almost comforting in fact. It's the routine heart stress test. Many people believe it's one of the best ways to check if their heart is still strong, especially as they get older. But here's where things become more complex than most people realize. A stress test is designed to evaluate how your heart performs under physical exertion. It can be very useful if you're experiencing symptoms like chest pain, shortness of breath, or unusual fatigue. In those situations, it helps guide important decisions. But what I'm about to tell you might surprise you. When used in people without symptoms, especially after 65, the benefits become much less clear. I've seen this happen too many times. Someone feels relatively well, maybe just normal aging, a bit less stamina than before. They go in for a routine check and a stress test is ordered just to be safe. But the results come back slightly abnormal. Now suddenly, everything changes. That slightly abnormal result often leads to more testing, imaging scans, possibly even invasive procedures like an angiogram. And while those follow-ups can be necessary in certain cases, they also carry their own risks, especially in older adults. Most people don't realize that stress tests are not perfect. They can sometimes suggest a problem where none truly exists. These are called false positives, and they can open the door to a cascade of interventions that may not improve outcomes, but can increase stress, cost, and potential complications. There's also something else that matters deeply: your baseline level of health. As we age, it's normal for the body to change. Exercise tolerance may decrease, heart rhythms can shift slightly. These changes don't always mean disease, but they can sometimes influence test results in ways that lead to unnecessary concern. Now, this doesn't mean you should avoid heart testing altogether. If you have symptoms or known heart disease, these evaluations can be critical, but routine stress testing in someone who feels well, functions independently, and has no clear warning signs may not always provide the reassurance people expect. Instead, I often guide my patients to focus on what truly supports heart health: managing blood pressure, staying physically active within their limits, maintaining balanced blood sugar, and paying attention to subtle changes in how they feel day to day. Because sometimes the most important signals don't come from a machine, they come from your body. And learning to recognize those signals before jumping into testing can make a profound difference in how you protect your health moving forward. There's one more test that often flies under the radar, something many people agree to without much discussion because it seems so routine. It's the full body scan, often marketed as a quick way to catch everything early. It sounds appealing, doesn't it? A single scan that looks at multiple organs, searching for hidden problems before they become serious. For someone concerned about cancer, heart disease, or aging in general, it can feel like a powerful safety net. But what I'm about to tell you might surprise you. These scans can sometimes create more questions than answers. I've seen this happen too many times. A person goes in feeling relatively well, hoping for reassurance. Instead, the scan picks up small incidental findings, tiny spots or irregularities that may never cause harm. These are often called incidentalomas. Most people don't realize how common these findings are, especially as we age. The body changes over time, and not every abnormal-looking image represents a dangerous condition. But once something is seen, it's very difficult to ignore. That's when the cycle begins. More imaging, more follow-ups, sometimes biopsies, and with each step, more anxiety. There's also the issue of radiation exposure, depending on the type of scan used. While a single scan may not be harmful, repeated imaging over time can add up, something that isn't always discussed clearly beforehand. And perhaps most importantly, there's no strong evidence that routine full-body scans in people without symptoms actually improve long-term health outcomes. In fact, in some cases, they may lead to unnecessary procedures that carry their own risks. Now, I'm not saying imaging has no place. It absolutely does, when there's a clear reason. If you have symptoms, a known condition, or a specific concern your doctor is evaluating, scans can be incredibly valuable. But using them as a broad just-in-case tool, especially later in life, requires careful thought. I often remind my patients that more information is not always better information, because the goal is not to find everything. The goal is to find what truly matters and to act in a way that supports your health, your comfort, and your peace of mind. Sometimes, the wisest decision is not the most aggressive one. It's the most thoughtful one. And that distinction can protect you from a path of unnecessary worry that many people never see coming. There's something I want to leave you with, something that, in my experience, matters far more than any single test. It's the idea that good healthcare is not about doing more. It's about doing what truly matters for you. Most people don't realize that as we age, the goal of medicine quietly shifts. It moves away from aggressive detection at all costs and toward preserving function, independence, and quality of life. But this shift isn't always clearly explained, so people continue with the same routines, the same yearly checklists, without ever being told that their needs and their risks have changed. What I'm about to tell you might feel simple, but it's incredibly powerful. Not every abnormal result needs to be chased, and not every possible condition needs to be found early to be managed wisely. I've seen this happen too many times. People get caught in a cycle of testing, then retesting, then treating, until their life starts to revolve around medical appointments instead of living, and somewhere along the way, they lose sight of how they actually feel. Because here's the truth your body understands, even if the system around you doesn't always say it out loud: feeling well, staying mobile, thinking clearly, and enjoying your daily life. These are not small things. They are everything. That doesn't mean ignoring your health. It means being intentional with it. It means asking better questions. Do I really need this test right now? Will this result change what I choose to do? Does this support the life I want to live? These are not questions of fear. They are questions of wisdom. And when you start thinking this way, something shifts. You become an active participant in your care, not just a passenger being moved from one test to the next. Now, I want you to hear this clearly. None of the tests we've talked about are inherently bad. In the right situation, for the right person, at the right time, they can be incredibly valuable. But blindly continuing them, without context, without conversation, without understanding, can sometimes lead you away from the very thing you're trying to protect, your well-being. So, as you move forward, I encourage you to stay curious, stay engaged, have open conversations with your doctor, Share your priorities, your concerns, your goals, because the best healthcare decisions are not made out of routine. They're made out of awareness. And sometimes, the most powerful thing you can do for your health is not adding another test. It's choosing wisely which ones you no longer need.